Helen Holmes, Year 8.
I recently read a quote that the NHS is slowly dying. What are you going to do to resolve this matter?
And who would you like to answer that first?
Carol.
Sorry, Caitlin. Yes. I'm sure you'll have seen in all the press and that the NHS is just our big thing. The Labour Party is so passionate about it. It was born under a Labour government, and we're just, you know, the reason we're getting so much support at the moment is because everybody's scared about what is going to happen to the NHS. And I know that it will be thrown at us that we started privatisation, but I'm really, really pleased that lots of our politicians now are holding their hands up and saying, yeah, we got this area wrong, we got this area wrong. Liam Byrne definitely got that area wrong. You know, what a stupid thing to do for anyone. You know, you wouldn't expect someone of your age, would you, to leave a stupid note like that. That was absolutely pathetic, in my view. And if I was in a room with him, I would tell him so. Back to the NHS. For me, it's about protecting it. We've said that, you know, that's our biggest thing. We will put let me quote you, because this is one of our actual 5 pledges. An NHS, the top line, an NHS with time to care. 20,000 more nurses, 8,000 more GPs. And it's the main thing that Andy Burnham, our health guy, is talking about. It's about joining up the services. I know from the casework that I deal with all the time about the mismatch of when you go into a certain sector and the records don't match up, the care doesn't match up, you don't go from place to place. This has gone on for far too long, and this is one of the major things that we have to fix. What I will say before Chris comes back and says we can't pay for any of this is, one of the other things we've said is none of our manifesto commitments require additional borrowing. So, you know, we're not saying that we're going to do something that we can't fund. It's all, because we've had that thrown at us for decades. You know, Labour can't be trusted with your finances. Well, our top team are trying to make sure that they can't have that thrown at them. They've looked into the background of it all, and we know where the money is going to come from. But nowhere is this more important than in the NHS. We can't allow it to keep moving on, and we can't allow it to be privatised. Money shouldn't be going in to other people's pockets for our healthcare. It should all be ploughed back into the system. In my view, I mean, that may not be everybody's view, but in my view, it should be totally in that way. It's far too important. It affects absolutely everybody. Absolutely everybody. You know, you will have all been born in a hospital. Unfortunately, probably most of us will die in a hospital, and we'll go there several times in between without all the other things that come into it. The social care element now is so bad, and one of the things that we are definitely against and a pledge that we will change are these 15-minute calls for social care carers. I've had calls, but it was probably a few years ago now. You know the flats in Tamworth? We've got carers going into there on a 15-minute call, and they hadn't got time to go upstairs, get the car pass, because Tamworth Borough Council weren't letting them park, and the wardens were giving them a fine while they were going to look after. So it's got to be all joined up. It can't be done in isolation. You've got to recognise that every element of it is about someone's quality of life. And a 15-minute call for someone to go in. I know from my father-in-law, I used to clean for him. That was what it was supposed to be. But what he wanted was me to go down there and sit and listen to him talk about the old times. And if you think about somebody who their only contact may be that carer going in a couple of times a day, but they're running in for 15 minutes, there isn't even time to make a cup of tea or say hello, how are you? So we've got to look at that whole package about getting social care and the NHS all bedded into one thing, so that one of the main things is that the budgets don't fight against one another, because that's what we find in a lot of cases, is that people try to protect their own budgets, and you can't allow that when you're talking about something as important as people's health.
Thank you. Chris, do you accept that the NHS is dying on your watch?
No, I don't. If you look at the figures since the NHS was founded in 1948, there's always been more spending on the NHS under Conservative governments than there has been under Labour governments. It's counterintuitive, but it is true. I believe, the Conservative Party believes, that the NHS must always be free at the point of use and there available when we need it. But that doesn't mean to say that the NHS mustn't change. I mean, it's been around for 67 years, but we wouldn't want a service in 2015 that was of 1948 standards. So of course the NHS has to change and adapt as the demands upon it change and adapt. 30 years ago, 40 years ago, the big users of the NHS were people with major conditions, cancer or heart conditions. And that was partly because of the lifestyle that we all lived. You know, people had sometimes manual jobs, they smoked, they drank, they had fry-ups every morning. So the sorts of ailments that the NHS had to cope with then was different to the ailments now, where we tend to be healthier, we live longer, and we need more geriatric, more aged care services. Now, we've spent, over the last 5 years, £12.7 billion extra on the NHS. And that's meant thousands more nurses, thousands more doctors, thousands more midwives, and thousands fewer bureaucrats to put the money into the front end, into services that matter for patients and their families. And we've said that if we're re-elected, we will invest £8 billion a year extra in the NHS, which is what the Chief Executive of NHS England, the Chief Doctor, if you like, has said that the NHS needs. And we reckon we can do that because we've fixed the economy, we've grown it, we've created more jobs, which means that taxes are coming in, which will fund that investment. Carol says that, I'll come to you in a moment, don't worry. Carol says that Labour is not going to borrow. Not strictly correct, because what Ed Balls has said is there will be no extra borrowing for revenue expenditure. That's the day-to-day expenditure that the NHS needs for your salaries if you work in the NHS. But he will borrow for capital expenditure. That's the investment you need to put into the infrastructure, the buildings, and the big kit. So I'm afraid that Labour does plan to borrow to invest in the NHS, and that borrowing has to be paid back. We say that we can make the investment that the NHS Chief Executive wants out of tax revenue from a strong economy that we have built. And that lady, I think, wants to come back and ask a question.
Yes, if you've spent so much money on the NHS and you've apparently got more nurses, doctors and midwives and things, then why am I constantly reading that hospitals don't have enough nurses to cover their wards?
Because one of the problems that the last government made, and I think it made it in all honesty, I'm not really criticising them, they tried to do the right thing, was that they changed GP contracted hours. Before 2004, GPs had to provide a service to you more or less 24/7, and that's why you used to have locum doctors who would fill in for your own GP if you needed a doctor at 10 o'clock on a Saturday night. Because of the changes to GP practices that the last government, or the Blair government, brought in, all of that ended, and that has meant that more and more people now go to A and E, whereas previously they would have gone to see their GP or call up their GP because there would have been a GP available. Now I think the way to fix that is to look again at the way we contract with GPs, but I also think it means that we need more urgent care facilities around the country, walk-in centres where people can go to get GP care and not simply have to go to Good Hope A&E, for example.
Yeah, thank you. Well, I've just got to come back to some of this. Christopher has said about how much extra money that the Tories have put into the NHS, but they have spent an awful lot of money on the reorganisation that nobody wanted and we definitely didn't need, not in the way that it was done. And it's not just a doctor versus A&E thing. What you're talking about is nurses on ordinary wards. We know there's a crisis in A&E. That definitely needs fixing. But the overall thing is that and the statistics and the stuff that nurses and doctors are telling me is that there is a crisis there, that we need more nurses. That's why we wouldn't be putting it in our manifesto if we didn't think that we needed those extra nurses. So they're not there. I've got friends who are nurses, and I hear it all the time on the doorstep about how demoralised people are who work in the NHS. The other thing that Christopher's just mentioned that I felt I needed to come back on, Tories have closed lots of the walk-in centres that we set up. But now, obviously, it's an idea that we need them again. So, you know, it's a shame. I went to one over in Walsall, happened to be over there and needed to go. And you have to sit there and wait a bit, but it was a fabulous thing that you know you're going to be seen. So, hopefully, yes, they've accepted that was good policy. So, we need it back.
An extension of that, a bit close to home, is Lorna's question. Lorna McIntyre, you can read your question.
What are your thoughts on possible closure of some parts of Robert Peel Hospital, and would you put anything in place to combat such eventuality?
Can I start on that? Because yeah, I don't know if you know, in the stuff I've got here, front of my thing, we did a campaign a few months ago now. We petitioned people, and we managed to get lots of signatures about the closure of the day case surgery at Robert Peel. People were coming up to us, and there was lots and lots of concerns about different bits that were being taken away from the Robert Peel. What you'll probably find out of your nans and granddads and maybe your mums and dads is this historic view that Tamworth, in the time of, I think it was before my time anyway, it was promised a major hospital on the lines of Good Hope. This didn't come, that we got the Robert Peel, which is a fabulous facility. And we are never, you know, I do say to people, I'm up front, we are never going to get a Good Hope in Tamworth, because that isn't the way the NHS runs anymore. We have centres of excellence. You wouldn't want to go along to the Robert Peel, it be a fabulous facility, but it not have the staff there who could cope with what you're going for. You need to go, you know, if you have a heart attack, you need to be going to Heartlands. If you have something else, you need to go to that centre of excellence. The Robert Peel is fabulous in coping with what we need in Tamworth. There are lots and lots of procedures that can be done there. What we found out, and this is where I get really frustrated with people orchestrating things. What we found when we were talking to people about the Robert Peel was that it seemed to be an agenda to get it to where it is and to say that they would close it. Because GPs weren't referring people to the Robert Peel procedures. And we even had a doctor from Good Hope who knew and could evidence that what was going on. He was very happy to use the facility there. So we did this petition. I took it along to the Director of Operations at Burton, because that's who had ownership governance over our hospital. And luckily, they deferred the decision until after the election. What we need to do now is keep up the momentum on them. I know Christopher's been involved, he's been speaking to the trust over there. But Tamworth deserves to have a facility, and it also, while we're doing those procedures that we do there, and some of them are quite complex, you know, we have a fabulous staff there. In doing the petition, I was dealing with the staff on that ward, and they were so demoralised in being told that the place wasn't fit for purpose, and they weren't able to do things. You know, there's a lot of really experienced staff there who've worked for ages, done a fabulous job, and they were just being told by the trust in an attempt to walk away from it that, you know, their services weren't valued. So I was more than happy to be working with them, but we do need, as a community, to really get out there and bang the drum for it. And what I would say to you is, this is something that you can take home to family members, is that if they do need to go for anything, they need to fight back against their GP or their consultant and say, no, I want that done at Robert Peel. Because the last bit of evidence I had was somebody who was due to be there and was told by their doctor or their consultant, oh no, you can go to Derby for that. And if that happens too often, we will lose our facility. So we need to fight back against it as a community.
Thank you. Chris?
Thanks. The question was, what are we going to do to ensure that we have decent services at the Robert Peel Hospital? I first became aware of the issue at Robert Peel about 18 months ago when a nurse came to my surgery and was a whistleblower, told me about what the plans for the day case surgery were. So I raised those with the Chief Executive of Burton Hospital Trust. Burton runs the hospital at Robert Peel, a lady called Helen Ashley. And I held a debate about it in the House of Commons. I went to see Jeremy Hunt, the Health Secretary, to ask him to intervene. His office contacted Helen Ashley's office, and we had some further meetings, including with the Junior Minister of Health, Dan Poulter. As a result, the hospital and Burton, the Trust, said, okay, we will look again at our plans. We will consult with GPs, we will consult with patients and the local community, we'll set up a working party to do that, and we'll not make any change at the Robert Peel until we've had that report, and we're still waiting for that report. I also went to see a guy called Les Lawrence. He is the chairman of the Heart of England Trust. Heart of England runs Good Hope Hospital. And he said, well, we will look at commissioning services that come out of our pot of money, the Heart of England pot of money, at the Robert Peel Hospital, which I hope means, it's not certain yet, and they're still working together, the Heart of England Trust and the Burton Trust. What I hope it will mean is that the services, Showcase Theatre and other services, can be used by Good Hope, and that means Good Hope's money comes into the Robert Peel, which will help fund any shortfall in expenditure that they currently have. The fundamental thing is that we've got to make sure that the Robert Peel provides services that people want and that people need. And I said earlier that as we age as a population, we have different kinds of ailments and conditions that need treating. I would like to see Robert Peel Hospital provide more bed sore clinics, more help for geriatric concerns, more mental health concerns, and that's something which another big set of words, the Clinical Commissioning Group in Tamworth, these are the GPs who commission the services at the local hospital, are now looking at. Fundamentally, if we're going to get good services from the Robert Peel, we need two things. We need people in the town using our local hospital, but we also need a strong economy which can pay the taxes, which can fund the investment in the Robert Peel and all the other hospitals locally to make sure